Coming up on A SkinDepth Convo.
I go to the airport and I show Brenda this nitro paste, and she looked at me, she goes, "Did you get gloves? Did you give you instructions how to use it? You could actually pass out on the floor." She says,
"Wait,
let's
so
get
she
on the
wanted
airplane."
a sterile field, Brenda. We're at the airport.
Yeah.
Where did you want to find the sterile field?
In an airport.
To find all this?
You know, I keep nitro paste in my drawer, but just to ward off evil spirits. I'd never use it. I have epinephrine. I mean, I have a toolkit.
This is a show focused on educating and inspiring all those in the skincare and beauty industry. But it is also a show for those looking to improve themselves from the inside out. In each episode, we explore the latest trends, breakthrough technologies, and get expert insight within the dynamic world of skincare and beauty. If you're looking to further your beauty education and nurture your passion, you're in the right place. Renowned experts and hosts Metaxia Dalikas and Francine Kagarakis aim to educate and inspire through their own experiences and are dedicated to enlightening and empowering enthusiasts and professionals in the realm of skincare and beauty. Join the conversation and the fun with A SkinDepth Convo. Welcome to A SkinDepth Convo. I'm Anna Kagarakis. Today's episode is a little different and a little spooky. With Halloween right around the corner, we thought it would be the perfect time to dive into some skincare horror stories. Now don't worry, no ghosts or goblins here, but in professional skincare, there are real scares and moments that remind us why education, safety, and the right products matter so much. And joining me today, we have a real treat. All four owners of Lira Clinical, Metaxia Dalikas, Francine Kagarakis, Brenda Cumming, and Anna Konstantin. And they're here to share their own stories from the treatment room and beyond. And we're kicking things off with a true scare, an incident Metaxia faced the day before the team left for Australia. It's a powerful reminder of how quickly things can take a wrong turn and what practitioners and clients alike can learn from it. So settle in, maybe light a pumpkin-scented candle, but let's get right to it. Metaxia, what happened the day before you left for Australia?
It's an experience, and we're going to share it because I think it's a learning opportunity for all of us, because I learned. We were leaving on the 9th to go to Australia, and I decided to go get a little touch-up because we had a presentation of over 200 people. So I went to a nurse practitioner, and she was just going to do a little bit of a filler, nothing crazy. And all of a sudden, she had a little left over, and she wanted to do this sensitive area, which Brenda had told me multiple times, that's a very dangerous area. And I had gone to my dermatologist, very skilled, and he's done it once a year just to keep that area nice and clean. And I listened to Brenda, and I even told her, the doctor, and he says that was very wise. But for whatever reason, not thinking, when the nurse practitioner the day before said, "Oh, I have a little leftover," she decided to do a little spot because I really wasn't due for it, but she had a leftover. And as she did this, all of a sudden, I started to blanch to the point that her body language changed. It was a concern. And she started to blanch. And she says, "What are you feeling?" And I says, "Oh my God, I feel like you have an ice pack on my forehead." So she's kind of looking around and starting to massage and mold that area. And I'm seeing this, I'm thinking, wait a minute, I've never noticed this before, never had happened before, and I've had derma fillers. And so, oh my God, what are we going to do? And then Anna's actually there and says, "Oh, this is not right. Something is not right because I've never seen this before." And all of a sudden the blanching came up, and it was like a gray, dull look. And I'm having this sensation. And all of a sudden she goes, "Well, I need to get some hyaluronase, the enzyme," and she left Hylenex. Thank you, Brenda. You're there to support me.
Absolutely.
Love that. Thank you. And then all of a sudden she left me there, and she said she had to go home and get the vial. So I'm waiting there about a half hour, and she comes back and she decides to inject. I think noticing her not knowing exactly, never happened to her. She's been doing this for 17 plus years. She's injecting me, and she's injecting me and rubbing and rubbing and rubbing. And good about a half hour. In fact, she sent us to get coffee while she went to get the vial, and then we came back. And
Wait a
then,
minute. You didn't tell me that. You left to go get coffee while you had an occlusion.
Yes, she told me, "Go get coffee, and I'll be right back." So we went downstairs to the coffee place and got coffee. And then when she came back, she injected it, but noticed that there was still some blanching on my upper eyebrow. And so she goes, oh, let me get some more. I went to the office to do the finals before we left. I went back to her office, and she's injecting. At this point, she's rubbing, telling me to put hot compresses. At night, it's getting worse. So I decided to call my dermatologist who was out of town. And she advised me to go see an eye doctor because I didn't know all the complications. I was embarrassed to call my partner. And
Never
then that
be
morning,
embarrassed.
I know, but it's the truth. This is real. Fran and Anna goes, hey, the only person who's going to give you the honest truth is Brenda. So on that morning, I called her and I was in tears. And she goes, okay, what's wrong? Typical nurse, typical friend. And so I told her, and she said a few words that's well known for Brenda. And she goes, you need to get to a doctor. I then went back to her in the morning before I went to the doctor's appointment, and she's trying to put some more of it in. And at this point, I have like a skid mark of the rubbing and the injections, all these little injections. I'm in my second vial with her. And I went to the doctor, and he wasn't there. The nurse practitioner says, it's kind of hard. I think they were kind of conservative as far as doing anything. The nurse practitioner wanted them to inject me with more. They did not. I went to the eye doctor. To be sure if I could have any problem with my vision. The doctor had no idea. The eye doctor had no idea what was going on. He said, I don't see anything. But Brenda met me at the airport on Tuesday the 9th, and all of a sudden they were starting to get pus. The nurse practitioner told me to get some nitro paste on the way to the airport, which I got. And Brenda, the first thing she says, what are you going to do with this? This is old school. What are you doing with this?
Yeah, stop a second. You were on the phone as we were going across the San Mateo Bridge. And as we're going across the San Mateo Bridge to be on a plane that we needed to be on 2 hours prior to boarding.
Yes.
And then, remember, Anna, we were in the car.
You made a pit
and
stop.
we were driving, and she says, we have to get a prescription. And we only had a certain amount of time, and we were losing our minds a little bit at this point. And you say it nice and calm, but that wasn't the situation in the car. Just let you know this. Okay.
But we're doing everything, and we're getting text messages, and she was text messaging me fiercely. She's concerned. Maybe, you need a plastic surgeon. I felt for her because she was trying to follow up for as much as she could at that moment. I go to the airport and I show Brenda this nitro paste, and she looked at me. She goes, did you get gloves? Did you give you instructions how to use it? You could actually pass out on the floor. Oh my God, she was panicking because it was old school recommended. There's so much more. So she says, let's get on
she
the
wanted
airplane.
a sterile field, Brenda. We're at the airport.
Yeah.
Where did you want to find the sterile field?
In an airport.
Find all this?
I keep nitro paste in my drawer, but just to ward off evil spirits. I never use it. I have epinephrine. I have a toolkit, and I have products to reverse, God help us, any injector, an occlusion, and it can happen to the most seasoned injectors, nurse or doctor. My issue is she wasn't prepared to manage this untoward event. I keep nitro paste just to ward it all off. Not going to happen. I guess some people still use it. I have to buy a new tube every year because it expires, but I don't care.
But wait, we weren't putting it on in a normal place.
Hylenex is very expensive, but any injector has to have it on hand and has to have at least 12 to 16 boxes.
But wait, see, you're not explaining how it was put on. It wasn't put on in the restroom. It wasn't put on before we got on the plane. It was put on where?
At the United Lounge.
Oh, no,
right?
no.
The
No.
United Lounge. No, I thought it was on the plane.
No.
Yeah, Anna was on the first row. I was behind her. You were behind me, and Brenda was behind you. And I remember Anna jumping from the front. Anna, do you remember that part?
Mm-hmm. Yeah.
Okay.
It was
and
on the plane.
It was on the plane.
No. After I slept, I woke up and there was this big blister. And all of a sudden, that's where Anna jumped from the front row to you. I was was in front of Brenda, and we opened up the paste with a cardboard, and she applied it. That's what she applied.
Because I didn't want to pass out either.
Oh my God.
All of us would have been on the floor. And that's,
yeah.
Usually, not United tries to avoid things like that, right?
Yes.
So I'm saying it's hot. It's hot. I'm burning. Wipe the damn thing off. Wipe the damn thing off.
She did say it that way.
She
That's some
she's
colorful
nervous.
language going on.
Yes.
All right.
Because
This is the PG version.
Yes. So, we get there and all of a sudden I'm having blisters and Brenda's saying, I go, Brenda, there's blisters. I saw that. She didn't want to alarm me. Thank you, Brenda. And so all of a sudden we get to the hotel. The first thing we do is call the hotel for help.
Concierge.
For a doctor.
I asked them, and they were awesome.
You did it.
No, that concierge, that
W.
gentleman was amazing. And then, of course, we get the concierge. And what is he? What's his name?
No, the doctor.
Yeah. I mean, the doctor. Yeah.
The concierge
she
got a
FaceTimed
doctor.
the doctor. What was his name?
It was Giorgio. Greek.
Greek.
Of course.
Greek.
He was awesome, though.
Awesome. Yeah. He helped us. I showed him around the room that we were in the room, just got off airplane. And so he had scheduled me to see a dermatologist, which was right away. He said, this is something that's serious. We have to really take care of it. So
But he got you on antibiotics, which is
training.
what I wanted. You needed to be on.
Yeah, he got me on the antibiotics. He addressed what he could, but wanted me to follow up.
Appropriate.
Right? I didn't go to the original training, and then I went to the doctor's office, and it was a dermatologist, a younger dermatologist, and he looked at me and he says, shingles. So I text message Brenda and I says, Brenda, shingles. And Brenda goes, bingo. And then all of a sudden he goes, I want you to come back to see my senior doctor. So I stayed a couple hours and the senior doctor came in and he looked at me and he said,
Hold on. You got to stop there. When you said shingles, we were talking about it, not knowing. Anna, Brenda, and I were at the hotel waiting to hear from you. And what happened was, I think somebody overheard it, and then they were all saying, oh, Metaxia shingles.
It wouldn't be ruled out. It would be part of a differential diagnosis, right?
Yeah.
Possible shingles.
Right. Now all of a sudden at the hotel they think I have shingles, which is another issue. So I go
That was
back.
another issue, because now they're wondering if you're contagious, yes?
So I go back to the senior dermatologist, and he looked at me, and he looked at the other dermatologist, and says, no. I'm an experienced dermatologist, very stern, and it happened to me. That is a clog there, and she should have treated it right away. Occlusion, thank you. And she should have treated it right away. You need this. He followed up with the added eye dropped. I gave me the whole stuff and told me to come back the next day. And it told me exactly what's going on, and never to go back to a injector who doesn't have the right precautions. As you said earlier, Brenda, things happen.
They do happen.
He was really, and he said it happened to him as an experience. He was very
He kept telling you how experienced he was, right?
Yes. And it happened to him, and it could take multiple vials to get through all these different areas. And he says, I think you're okay. He was more concerned about my eyesight.
Well, because the worst thing that could happen is you could have gone blind immediately. That's why I used to inject there when I was stupid. And then I just realized, you know what? I don't need that problem. That's why I wanted you to go to your you're very confident dermatologist. He does a great job on that.
Before you go to the next day, that's your G version. We're going to give you the PG version in just a minute. Go ahead.
Well, the first day of this massive event, I'm not there. I still have these blisters. My eyes have thighs, and it's just a mess. All of a sudden, I'm walking with a jacket on in the harbor,
and
crying,
she's hiding.
my hair,
She's
no
in
makeup.
hiding.
I'm hiding, and I'm walking. All of I hear Metaxia, and I thought, oh no. I turned around. It was Grant, our distributor there, with one of the biggest accounts talking, and they looked at me and they kind of felt bad for me, and they understood that I wasn't like ditching the event. I was really having an issue, but I wanted to run home. I wanted to take off, but I have to tell everyone, having a support system, having my daughter, having my sister, having my best friend there, being there to support me, gave me that a feel of comfort. Using the products, I have to say, being one of the owners of Lira, the products, the Mastica oil, the recovery balm, the PDRN serum, that got me through so much. And, clinical skincare is not just about beautifying the skin or addressing acne or pigment or wrinkles. It's about really being there as a resource. And I have to tell you, that following day, I went to the dinner. The BBs worked amazing. being supportive.
No, you went
is
to the
really
second
important.
day presentation.
Entire
The
room
second
was
day, yeah.
compassionate and supportive to you. Because again, it can happen to all
Very.
of us.
Yeah, and what I learned for it is that being honest and having the right tools, we're going to feel this, and this is why it's important to share this, because we shared this with the whole event. Things happen, but if you're well prepared and you know, again, knowing your scope of practice, understanding your scope of practice and the responsibility of it. And Brenda, I want you to kind of give the injectors, and I'll talk, and Fran and Anna will talk about the aesthetic part of it, but the injectors, give them a tip, because you really helped me through this, understanding this type of procedure.
Well, I think you have to be comfortable in the procedures that you're doing and have some experience. And again, you can be in this business for 40 years, just like, you know, your dermatologist. It can happen to any of us. The only issue I have is that there was no preparation for an untoward event. And telling you to go get coffee and not staying with you, that's basically abandoning a patient. I don't know if you guys want to say that, but that's what happened. So you were abandoned. That's strike number one. Strike number two, she didn't have the enzyme the filler buster, which is an enzyme, Hylenex, to dissolve, and you don't stop dissolving until you have refill again, until you have perfusion. So coming back, especially here, because this is the highest risk area. Anything
On the forehead.
Well, the about this line right here, because there's tons of arteries that branch off that can go straight to your eye.
And it went down.
Well, I know, and she was telling me this on the phone when I was. So it can happen. So where I would have a problem is the management of it. And thank God she's fine.
And I completely understand that.
And her beautiful eyes, she can still see out of those beautiful eyes. So, and she looks good from what I can tell now.
I have some scarring, but I have to
that.
wait. The dermatologist, yeah. And that, I mean, seriously, this could have been so much worse. My eye still has issues. I still have sensitivities, but compared to what it could have been. And this is where I think even with skincare and peels and treatments, there's always something that can go wrong that we have to be aware of, not shy away. We always say that within 24 hours, you should be available to talk to a patient or client that's had a procedure. Any heat, any change of the skin, anything that they're not comfortable with. Education is so important. I'm just trying to, share this story to say that we got through it. We could get through most of these things if we're well trained and well guided. I think being guided by Brenda, being guided by Fran and Anna, being guided by these doctors gave me the reassurance I needed. And I was just very fortunate. And I'm hoping you guys see this as a positive, because it really did change me as far as understanding how wonderful Lira products are, because I was lost. I was lost without the products, truly.
I wanted to add, because I think too, when things like this happen, I think as a professional, you have to be able to be calm. And I think what was happening was that she was panicking and reaching. And I think that energy of reaching and calling multiple doctors and panicking, that came on to Metaxia. That came on to my mom, because it was more so of she wasn't confident enough to reassure her. And I feel like that panic of try this, do this, do this. It was giving her multiple things to do, and
Not
she
prepared.
didn't know which one do I
Not
do.
prepared.
Not prepared. And like I said, it wasn't you make mistakes, but it's the confidence that you have. So when you're confident saying, oh, I know I could do it, but then when it happens, you're not giving that confidence to him. She made her panic.
When you're
And I
sticking
think
somebody,
that was the
you don't
frustration.
go, oh shit, or oops.
Yeah.
Nobody wants to hear that.
Yeah.
But
And
I
you're
agree
not like
with you,
saying,
Anna.
do this.
Panicking is
Yeah.
wrong. You have to be calm. You have to tell the patient,
Mm-hmm.
this is happening. You have a beginning of occlusion. We are going to take care of it. You are going to be fine. And then you have your
Right.
products right there. You don't leave that
Mm-hmm.
patient. You check for capillary refill. And, honestly, 9 times out of 10, it is fine. But it's
Yeah.
reported enough, and I've heard it enough to, again, your dermatologist has a lot of cojones, and I respect the fact that he does it, and he does a good job.
Let me ask you something. So here's the thing.
Who are you
We all
asking?
understand Metaxia has been this kind of everybody, but Metaxia, you have been in this industry for years.
Yeah.
You have the support system with Brenda, you have Anna and Francine. You have the support system for a client who just walks in and is just getting in, and they don't have that background. Like, somebody who's, maybe they work at a grocery store, maybe they're a teacher and they go in to get a treatment done and they don't have an idea.
Anna, they don't
That is
even
a very
ask for
difficult thing.
certification. Like patients will come in,
Right.
hop on the bed or something,
Yeah.
like some Botox will have happened and they'll come to me and I'm like, well, who did you see? I don't know. Well, were they a registered nurse or a physician or a nurse practitioner or a PA? I don't know. They need to educate themselves as well. There's accountability on both sides. And Metaxia to a nurse practitioner has been doing it for a long time. Again, she probably does a great job. The problem is that an event happened that she did not manage correctly and was not prepared for.
Yeah.
That's the issue.
So then, just so people know, what is blanching? What were you experiencing, and what did it look like? So that way, if somebody has happened, then they know what to expect and where to go next.
For me, it was the feeling of cold. There was no blood flow, and the color turned gray, and it was really literally like a gray, but that sensation of cold because there was no circulation, and then all of a sudden, hearing other people, it could blanch all the way. This one lady at Australia said that she saw a client or patient that blanched all the way that she lost her hairline. It kept going and going. It travels.
Well, it's going to follow the artery.
Yeah. So it definitely is, you see it blanching, you feel it cold. You definitely, if you've had it in fillers, you know that this has gone wrong.
Anna, you bring up a really good point though, because normally when you get fillers or you get injectables, you don't know the areas, like you said, above the 11, you don't know that could happen. So maybe that is something that, the questions as you're going in, somebody just wanting to get Botox, you're in that age, you're like, oh, I want some Botox or fillers. Maybe that should be a number one question. What are areas that I need to be concerned of? So when they're going to do it, you have no clue. You're just assuming it's a filler, but you don't know that if you do it in that area, it could cause it. Because I had no clue that it could cause blindness. I mean, just seeing her in her eyes, I was like, oh my gosh, now this is, and you see the blanching part of it, but what is the definition of blanching, right? When it was doing it, she was like, oh, it's just blanching, like it's a no big deal. But it's like, well, what do you mean blanching? So I think that is another word too, is you're assuming that the person that you're doing the treatment on knows what blanching is.
Yeah.
And knows that, is that the only area that it could blanch, or is there other areas in the face that, I think Brenda said that it's normally above by the forehead, by the 11s, it could be by the nose, right? There's certain areas that because of all the vessels, right? Because of all of that, they're flags, and that people should be aware and probably should go to a derm or, should ask those questions because it could happen to anybody.
Well, on the plane, I remember Metaxia's eye. Wasn't it inside of your eye? See, you're starting to have some kind of...
I got purple. It was all...
That,
it was a mess.
That I was okay with. The bruising. Because she was, she was aggressive. It was... Usually they lose their vision pretty quickly.
And that was scary. And I think the more we read into it, it was very, very scary at that point. And even the fact that you went to go see the dermatologist, you saw her, his PA, then you went to see your ophthalmologist to make sure, but your ophthalmologist said he never heard about it.
Well, that's like if somebody gets a chemical peel and it's a burn, where do they go? The emergency room. Do you think...
They don't know.
And they don't know about occlusions. I mean, they don't have all that. They have no idea. So, again, there has to be a chain. And I want to know, has he scolded you yet for cheating on him?
He wants to see me. He wants to see me.
No, you're going to get a lecture. Can I
go?
go? I would actually like to meet him. So.
He's a cool guy. He's a and I'm going to put his name. I don't put names out, but Dr. Wallach. He's been in this area for a long time. And when he first started, and the caution that he takes, and the sincerity. He was out of town, and he got on the phone.
Him, and he explained what he was doing. He probably told you what could go wrong too, right?
He told me that I hope you learned a lesson. Never do that again. And that I'm there for you. And he got on the phone. He was in Tahoe. He got on the phone. But again, the reassurance that all of you are saying, the reassurance played such an important role. I mean, I really think I felt I'm going to be okay after hearing all the positives that, I was getting from all of you. Meant a lot.
All this
or
goes
even getting
with
on a
peels
plane.
too. Like, especially some of the Lira peels we have. So,
that's true. But even getting on a plane.
Yeah. Getting on a plane. Sorry.
Okay. But remember, she's getting all these injections and getting on a plane the same day. that night we were getting on a plane. I think you did call Dr. Wallach and ask him, can I get on a plane?
Yeah.
And that was that was a big deal at that point. So to be able to get on a plane and be reassured that you can get on a plane helped us during the trip.
Aren't you supposed to do the hyaluronidase? I'm totally going to butcher that, but aren't you supposed to do that like the day it happens?
Immediately.
You're not supposed to do that. Right. You're not supposed to do it the next day.
That's what I said. I'm like, you keep dissolving until there's perfusion.
And that's what the doctor said when she was in Australia. He said, you don't wait.
If there's a granuloma or something in a lip or a bump somewhere, that's not an occlusion. That's just something that migrated or balled up. Those you could take out slowly, but not a vessel.
But then the next day in the morning, and then to go in the afternoon, and then to go right before we're getting on a plane, it like defeats the purpose, right? It should have all happened the day she had
one day and not
that was the fear
until she was perfusing.
And that was the fear. Imagine on the way to the airport.
No, she wanted me to bring Hylenex with me on the plane. Like, what am I going to do? Inject her on the plane?
And getting more of these injections. It's crazy.
That's cool. That's a very important point. She was injecting me on Monday. She was injecting me Tuesday before I got on the airplane. She wanted Brenda to bring, thinking that I might need more. That what I learned from it, it's an immediate response. You don't wait 24 hours because this time is blocking that circulation and you're killing the skin or killing something there. You don't wait 24 hours. You really are, you're hurting that area. So by her not knowing and trying to keep injecting me 2 days later or a day later, it made no sense.
The good news, when we did get to Australia, Metaxia remembered only the time she went outside of the hotel. The first day when we got there, she had her sunglasses on and we were going up the escalator. They started seeing you then. Remember? Some of the people started seeing you, so we couldn't say she wasn't there.
Yeah.
She was like,
and so we knew we had to say something on the first day of the event. And so we did explain to everyone there exactly what happened. And everyone was so very polite, very nice, and
understanding,
very compassionate. And they all wanted you to be there the next day. And they were rooting for you to be there the next day. And you were. And I think the event was a complete success because you were able to be there the second day. You were able to be there at the gala, especially for the awards. So we were able to complete the event with you there. And that was wonderful.
Well, I think it brings up the learning experience at the event because you're training. And I think it was nice because it brought up, first of all, it's honesty. It takes a big person to be able to share that. And second of all, admire that because a lot of people wouldn't. And then people respected that because it brought up conversation and they felt comfortable to share, oh my God, this happened to my friend, or, oh my gosh, I need to be more prepared when I'm doing skincare. So I think it opened up that this could happen to anybody, but it opened up a conversation of that everybody needs to be cautious. And when you're doing that, to be confident that, yes, if I'm doing a peel or doing injectables, I have the proper tools to be able to get through it.
Yeah, I'm just saying that's the important thing, always be prepared.
I have to tell you something. We stress about our protocols with Lira. When you follow the protocols to the T with Lira and not mix other products, we're there to support you if these happen. For example, we have representatives, we have contacts. If someone was to follow a protocol and have an incident that would go wrong or questionable for them, that's where they could reach us and tell us, hey, I need help. We will follow through and help them through that. We'll check everything, we'll be there, support them. We have had incidences where there was question about how the procedure went or post-care. So for us, following a protocol for Lira gives us the guidelines to support them through anything that happens with Lira peels. So that's important to understand. That's really important that protocols are there to be followed, and we are here to support the esthetician or the skin therapist throughout whatever they do with Lira. And that's where I think this education and the support, the resources are very valuable. And I'm very, very proud that Lira has these protocols, have these educators. We're here as owners. We are part of this business on a daily basis. If there was a problem, we're there, and we don't let the person feel that they're alone.
Well, a lot of the training is start conservative and then work progressively, stronger, and stronger to make sure that you know your client and your patient, you know who you're dealing with. And also, there's also times when you're going to hit an area where it might be too much for a client. You need to know how to go back. And this is very, very important. Just going forward and not reading the skin is very important. You have to understand your client's skin type, exactly what you're dealing with, and what they're doing at home, pre and post. Very, very important.
Yep. And this conversation is incredibly important, just so everyone knows. Don't be complacent. Always have all the safety protocols in place, because you never know. Anything can happen. Strange things happen, you know, even if you're the most experienced person. That's one thing we've learned today. But you did make it. Brenda, do you want to add something?
I was just going to add that I had a very bad experience with a peel, like not an injectable, when I was just getting into this. I'm pretty sure I called Metaxia. But I have a patient, and it's a friend. That's when things happen, right? And she was getting peels, but I knew she was an outdoors girl and she was a runner. So I lectured her about this. And then I was in a room and I borrowed, mistake number one. I should have gotten more information from my girlfriend. Mistake number two, I borrowed another machine. It was a crystal microderm machine. I'm going to really date myself now, but remember the glass loop handpiece? Remember that?
Oh, wow.
First of all,
we're going back.
why are we doing a microderm with glass, right? So I hadn't really played with it much, and full-on crystals and, you know, going to town. She looked great. Then I said, well, this is how I learned about acids and microderms. I dropped a glycolic acid on her afterwards.
Okay.
And she wasn't complaining. She was fine. So the next day she texted me. She goes, hey, Bren, my kids say I look like I slept with a lion. And, you know, I always take a lot of that with a grain of salt. I'm like, oh, yeah, whatever. Send me a picture. Oh, my God. So I said, all right, come on over. I was calm, but not on the inside. I said, come over. She walked in, and it was like, you could tell my pattern. And I said, all right, we're going to take care of this. You know, I'm going to fix it. Thank you, Jesus. She didn't scar. But I fixed it on my dime for weeks and weeks and weeks. Yeah. And I love this girl. She's one of my dearest friends. So months later, she comes in. I said, not using that microderm. We're just going to do like a mild peel. Oh, my God. And it wasn't my microderm, so that's bad. So I did a mild peel on her, and it was lunchtime, so I went across the street. And she's walking out of the tanning bed right after I peeled her.
Oh.
And I said,
that's right, I remember.
I said, what are you doing? And she was like, cowering. And I said, what are you doing? Yeah, and she's a badass, too. Like, she's a runner. She thinks I'm afraid of her. I'm not. But she said, I'm just getting a baseline. And I said, for what? She goes, for a tan to go on my trip to St. Thomas. And I said, when? Tomorrow. And I said, we're done. I'm not peeling you anymore because you don't follow instructions. But that was a humbling, like, I wanted to throw up. So I can imagine how your nurse felt. She probably wanted to throw up too. But I will say, because I've been a trauma nurse for so long, you got to stay calm. And you have to be in charge because all patients want to know, or clients, is that you're in charge and you're going to help them, and you're not running away from the problem. You're not answering their calls. You won't see them. That's right. That's how you get sued. And also, that's not ethical. So how bad I know I called Metaxia on that. I called another girl, and I worked on her once. I worked on her. I gave her products all out of my pocket. The revenue I made on that stupid micro, didn't even care. I wanted her to be better, and she was, because I stuck with it. We didn't even have any, lightening agents back then. No. Natural. Very few. And I didn't end up having to put her on hydroquinone, but I was sick for months about that. And then I almost killed her when I saw her out of the tanning bed. Like, what?
I can imagine.
Anyway, I didn't mean to go sideways, but that was a bad peel.
No.
That was a bad microderm peel experience. And then I figured out, wait a minute, a 1-2 carbon chain going in on open skin? Maybe not. Let's reverse that. I think we were all doing that, though, back then, because microderms were popular.
It's common.
Remember my first microderm? Gosh, that's in the 90s. That tells you how far back we're going on that one. Thank you for that one. And I remember it was actually a physician. And we were doing a demo, and while he was doing it, it was bothering me. Metaxia goes, stop being a baby. I remember that. She goes, don't be a baby.
Was it a crystal one or a diamond?
It was a crystal one, yes, and he was going in for it. And so Metaxia goes, oh, it looks great. It looks great. I'm, getting some erythema going on. And I go, but it doesn't feel right. Yeah, and he goes, it's supposed to feel like a cat is like scratching your face. I don't have a cat. I don't let cats scratch my face. I don't even know what that's supposed to feel like, number one. All I know is the next day my face was swollen. and I had hives all over my face, and it lasted a week. And I had a trade show, and I had to go with my hair in
Then
front
stop
of my
being a
face.
baby.
Yeah, so don't tell me, don't be a baby. Everybody's different. But it's my sister, and she's always going to be a little more aggressive.
I had to get on
When it comes to me,
steroids
at
when a
least.
dermatologist did my microderm. And it was a crystal one.
There you go.
Oh, remember we were talking about this? I had to wash my own face. And I had to sit in
Yes.
the chair, and she comes in, and I said, is it supposed to hurt? She goes, yeah, you're supposed to feel a little bit. And I said, could you turn it down? Because I felt like I was sandpaper. And then I saw him at the office like 2 days later, and I went, and it was my birthday. I had a pumpkin face. I was red and swollen. He goes, classic doctor.
Yeah.
Oh.
Okay,
Do you want me to
wait.
write you a prescription for steroids? And I was like, no. Okay, sorry.
No, real quick. She said about this microdermabrasion, but when she did it on me, she brought blood up. And
You probably like that, though.
So, yeah.
Whoa.
She
No,
probably
You
did.
make it sound like I didn't know what I was doing. I did a beautiful job. It was perfect. You were nice and pink. You had some erythema. And you know what? You were trying
And
that
petechia.
line again. You were going for it.
Yep.
You were going for that line. We're going to a Greek wedding the next day. She goes, you need to do more. You're too light-handed. You're not doing it hard enough.
I believe you.
Oh, really? And then I went for it.
Hold on.
And it
The
wasn't
lesson
gushing.
is-
It was just
the
a little
lesson-
bit of blood. Okay.
The lesson is, just because a patient tells you to do it,
Don't do it. You're in charge. You're the one with the license, right?
Excuse me, she
So I
looked
got her.
fantastic.
I got
You had
her.
some nice inflammation going on. The lines were not showing, and it was
was
just
blood.
a little bit. But there are no blood vessels in the epidermis. That's all I'm going to say.
Anna, do you have your own horror story for us?
Yes, of course. Everybody has a horror story. So I was getting my aesthetic license, and I go to the school, and I was doing basic facials. And one of the instructors who my mom taught chemical peels, mind you, this is the instructor. And my mom, when she went to aesthetic school, taught the instructor chemical peels. And she realized, well, since Metaxia taught me, and this is her daughter, she's probably just as great as Metaxia and loves peels. And by the way, when I went to aesthetic school, I loved waxing. I loved the opposite. Still liked chemical peels, still liked facials, but I loved more of the waxing part of it. So she comes up to me, I think I did one facial, and she comes up to me and she goes, you want to give a TCA? A Jesner peel. And I said, what? She goes, this lady's coming in, and they come to school to learn, right? To get treatments done because it's discounted, right? And so we're learning. They know we're learning. Could you give a Jesner peel? A Jesner peel, I've only done one facial, and it was a European facial, and it was nothing aggressive. And I'm like, oh, I don't think I'm confident enough. She's like, I'll help you. Okay. She walks me through it, and I start the treatment.
What's
and
her
at that
Fitzpatrick?
time, her Fitzpatrick was a 4.
Okay, I kind of figured.
Of course. But I'm a little light-handed, so I lucked out. I'm a little bit more cautious, because that's the other thing. When you do Jesners, you could do 1 layer, you could do 4 layers, but what's the pressure, right? What pressure are you putting when you're applying them? So I go in there and I do the cleanse. I'm all confident. I got this. And as I'm doing the treatment, I have to take off the cleanse. And at that time, they were using the sponges, the yellow sponges. And they were putting the yellow sponges, I'm going to totally edit myself, in the quartz. Okay?
In the what?
So quartz is a quartz. Oh. It's like a purple solution that they would put in a watered solution. And they would put the sponges, because it was a school,
saving money.
Like
the
kind of like
quartz.
barbicide kind of stuff?
Yes.
Oh
Yes.
my gosh.
Exactly. So I go and I get the sponges out, and because they didn't have any, so I had to go get it. So I'm wiping them down, and as I'm trying to wipe off the cleanser so I get the barb, I get the wrap, and I'm wiping it off, and all of a sudden I see it's dark room, because why is it dark? It's dark. I see these like yellow, like sponge all over her face. So I'm trying to take the yellow sponge off of her face, and I'm like, oh my gosh, I'm sweating at this point. I was like, I can't get the yellow sponges. So I go back and put a towel, cold compress.
Is she on
Take
fire?
it off. No, I didn't even apply it yet. I just took off the cleanser. I couldn't get the sponge off her
I missed
face.
that part.
So then I finally I'm taking all the sponge off, my second treatment ever doing at school. So now I'm doing, okay, here we go. Here's the Jesner. I get my gauze. I listen. I'm hearing my mom. Like I see her do it many times. I'm squeezing it to make sure it's not all over, right? I know this. I'm applying. I do my first application. I'm now seeing the sponges all over still. I didn't get them off. So I'm doing the second. I'm doing the first application all over. Looks great. I'm fanning her. How do you feel? Oh, Dali, it's great. Do another layer. I'm like, oh, okay. So I'm looking, no erythema. It's dark in the room. How can I see erythema? It's dark. So then I'm looking, I'm waiting. I do another application, light as could be, because I'm like, and then I'm looking, I'm like, oh, you got a little erythema. This looks great. So she goes, oh, are we going to do another one? I'm like, nope, it looks great. Put a light moisturizer on. At the time, didn't realize I put a thick sunscreen on because at school they teach you sunscreen. So I totally put this application of sunscreen on her, and I still see the sponges all over. Couldn't get that off. I'm putting lip gloss on her, right? I lift her up, and as I'm like lifting her up, I'm wiping it. I'm like, oh, it looks so good. How do you feel? She goes, oh, it feels so great. After she left, I'm in the cold sweat. I was like, never again. She was fine because I think I was so like application. I knew, and I did light application. The teacher's like, oh, you're a natural. And I'm like, I'm a natural. I couldn't get the sponge off.
I want to know what that chemical was on top of a chemical peel or underneath.
It was breaking down the sponge.
It was breaking down.
Did you ever see her again?
No, but I mean, luckily she did great because I didn't do a strong application, but note to self, never do sponge, never in the dark. Why am I doing a Jesner in the dark? Right? It's not a feel good treatment, but those are like the horror stories that ever since I did, like ever since that experience, I've always done it in a lot of light. I've had my woods lamp prepared. But it just scares you where you're like, oh my goodness. But that's my horror story.
It's pretty bad.
Oh no. I say this one on the road a lot, and maybe a lot of people have heard it before, but Metaxia was using me for a demo for some doctors. And in the days when I had flared up hormones, I don't have it anymore. In those days, I was in my 30s actually. See, that's how far back this is going to be. Late 30s, early 40s maybe. And
that's not that long.
That's not long. Absolutely. Yeah. So what happened is she wanted to do some fancy work here. So she wanted to do a 5-layer Jesner. And so I didn't want to go, but she couldn't find anybody. So I had to go. And as she's doing the first layer.
You're a cheap patient.
I was cheap labor. There you go. I was a cheap patient.
Cheap patient.
So I go there and I should have said no, because what happened is I flared like crazy because I had hormonal skin. Okay. And then she's ready to go to do her, 5 layers. And I said in Greek, as I had tears coming down my eye over here, I go, don't touch me again. Okay, I'm going to kill you. I did say θα σε σκοτώσω. If anybody's Greek, they know exactly what that means. I'm going to kill you. Okay? Don't touch me again. So she's in the middle of all. No, she didn't. No. She knew to stop because
her eyeballs.
I did not. My eyes are closed. They were tearing. See, her version's always a little different and stuff. But all I remember at that point, yes, my skin was not okay for the next few days. I'm not going to lie. It was great after that because we took care of it. But you do need to remember, you have to know when to stop. Yeah. Okay? Like Anna was saying, the instructor could have told her, keep going. The patient or the client could have told her, keep going. But you have to know when to stop. You don't do the same thing over and over again. You have to read the skin, know what's going on, and know when to stop.
Remember when we were doing peel demos with that other company in Vegas in 120-degree weather? And we did TCA. And on one of my coworkers, and she had pitting edema on her face. She was so swollen because of the heat and the TCA. Mm-hmm. And then they were going to make me do one, and I told the person doing it, I said, don't put TCA on that gauze, just pretend.
There you go.
And so she did. I think we used a primer or something, and I was like, there's no way I'm getting a TCA in 116-degree weather at a trade show.
Wait a minute. Did you put primer on instead?
Yeah, we faked her out. I said, you know who I'm talking about. And I said, just pretend this is the TCA. Because she was talking. And I was like, please don't put that TCA. Because the other one had a pumpkin head. And you could press on her skin. And it was edematous. It would just stay like that. And oh my God, that was horrifying. So yeah.
Now, did we scare everybody enough?
Yes.
Yeah, I think we did. I think we might have scared everybody enough. So again, lessons at the end of the day. 1, Have your safety protocols in place always.
Yeah.
Do not be complacent. That is number one also. Oh, it's like 1A, 1B, 1C, 1D.
And know how to manage.
Not be complacent.
Know how to manage a problem.
Yeah.
Yep.
Yeah.
Stay calm.
There's one thing I wanted to add, because it's in all of our stories that I think are really important, is that they sometimes, and even Brenda's story, they sometimes don't tell you exactly what they're doing. And it's your job as a professional to always ask, like, I am doing this treatment, but are you going for a run? Are you going to watch?
But they lie, Anna.
Well, yeah. And the reason why I ask that is because the best is they're like, I'm not in the sun, I'm in the shade. And it's like, it's not the sun, it's the heat. So it's asking those questions 100 times where you're like, I am doing this procedure. This is what it's going to do. This is what your downtime is. And again, I need to make sure that you're not going to be watching your kid's soccer game. You're not going to be watching, going on a run. The best stories or the best nightmares or the best pictures we get is, oh my God, I'm going on a cruise, but I'm doing this run. And right before my esthetician gave me a Jesner. And then I woke up and I can't do my run. Well, of course you can't do your run. Why are you getting a Jesner before you're going on a run? So just making sure as a professional, you're constantly asking, there will be downtime. This is what we're doing. I need to make sure you're not. And ask those questions. This also includes tanning beds. Right. This also includes tanning beds, going outside. You'll be surprised too, and I've heard it with laser stories, is people will go and bleach. It's old school now because they have like hair removal, but years and years ago, they would go and put that bleach so they could bleach like hair or peach fuzz. Yeah. And then they would go and call and they'd be like, oh my God, I got this laser treatment. Look at what happened. And then I'm like, what else did you use? Oh, I nared it right before. And then I put steam. So it's like a lot of these treatments, it's these stories, or my best friend did it. A lot of these stories are like either you did it on your best friend or you didn't get the full truth of what they're doing after. So always asking those questions, even if you do it once, do it multiple times so they understand this is what we're doing. This is what the downtime is, or there's no downtime. And if you have any of these occurrence, please email or text them so that they can get the right, proper people to help.
Always follow up. You always follow up.
I agree.
Always.
The big thing, you have the knowledge and the experience to say no.
Yes.
You cannot have that treatment. With smart peels, you can have other treatments that you still get results that day, but have the strength to say, no, this is not the right peel for you. Your skin cannot tolerate it. This is what we're going to do. So having all that knowledge, understanding who your patient is, and at the same time, the experience to say, no,
you can
it is
say
not
no, we're
right
not a good fit.
You.
You don't have to take that person on, right?
That's right.
Yeah. There should be red flags flying all over the place on that, right? It's hard when you're starting a business.
Your clients trust you. Oh yeah.
Yeah, and it's on me. Like
100%.
She's my friend, and it was my fault. Like I didn't ask, and I should have known.
My sister,
huh? Your own sister. Yeah.
Well, I think that's going to be enough horror stories for today. I think we scared you all enough today, but it was definitely a lot of fun. And make sure if you want to hear wonderful stories like these in the future, subscribe to A SkinDepth Convo, any of your favorite podcast platforms like Apple Podcasts, Spotify. You can also watch the show on Spotify and on Lira Clinical's YouTube page at Lira Clinical. Follow SkinDepth Convo on all our social media channels. You can find us on Instagram, TikTok, Facebook, you name it. Just go to @SkinDepthConvo. Also, if you have any questions or if you maybe want to send us your own horror stories, feel free to email us at info@skindepthconvo.com. That's info@skindepthconvo.com. Thank you again, Anna and Brenda, for joining us today. That was a lot of fun today. And it was such an awesome
Metaxia, I'm glad that everything worked out.
Thank you. I'm very fortunate to have all of you as a support.
I do want to go to your dermatologist appointment with you.
Okay.
She will.
Next week, you're coming to town.
That'd be great.
Perfect. Scold you. Thank you, everybody.
Thank you so much for all of us here at SkinDepth Convo. I'm Anna Kagarakis. We'll talk to you all soon.
This podcast is brought to you by Lira Clinical and the award-winning Mystique Illuminating Beauty Oil. Mystique Beauty Oil's amazing skin-friendly hydration delivers potent antioxidants and anti-inflammatories with Lira Clinical's exclusive Mass Tech brightening technology. This luxury oil blend is infused with vitamin C for a clean, dry finish on the skin. Use by itself or add to your favorite hydrator. Beauty oil delivers your glow and go look. Contact your local Lira retailer for additional information at liraclinical.com.